Good afternoon to all the media houses that came and the public of the public in the Republic of South Sudan. I've called here today because the Ministry of Health, Republic of South Sudan, has got a press statement, and our press statement reads: Conjunctivitis, red eye disease outbreak in South Sudan. The Ministry of Health, Republic of South Sudan, would like to inform the general public of an outbreak of conjunctivitis, commonly known as red eye disease. The outbreak first started in Nimule Payam, Magwi County. This outbreak was initially detected among the travelers from Uganda, where similar cases has been reported, an outbreak of conjunctivitis declared by the Ministry of Health, Uganda. The health authorities in Nimule have heightened surveillance at the major points of entry, PoE, to identify cases, collect samples to confirm the causative agents, and manage suspected cases at the nearest health facilities. As of 16 April 2024, a total of 382 suspected cases were screened and managed. That is 297 at Nimule PoE, which is port of entry, and 85 at Nimule Hospital. At the moment, the cases are also reported in Juba. We shall continue to monitor the situation in Juba and various part of the country. Conjunctivitis, characterized by inflammation of the conjunctiva, that is the membrane mucus that covers the white part of the eyeball and the lines of the eyelids, can be caused by virus factors, including viral and bacterial infections, among others. Viral conjunctivitis is the most common form and is highly contagious and can spread from person to person through direct contact, sharing of personal items such as towels, pillowcases, facial contact, and sharing of eye drops or eyeglasses. Symptoms may include redness in the eye, redness of the part of the eye or inner eyelid, increased tears, thick yellow discharge over the eyelashes, itching, blurred vision, and sensitivity to light. The contagious period is within the first 10 to 12 days, but the infection can last up to 3 weeks. In order to control the spread of this disease, the Ministry of Health, with the key stakeholders, have initiated several measures, including promoting personal hygiene, also known as WASH activities, that is water, sanitation, and hygiene, strengthening surveillance, managing and treating affected individuals, sensitizing the public about the disease and prevention measures, and orienting healthcare workers on investigating and responding to the cases of red eye disease. In order to contain the spread of the disease, the Ministry of Health urges the public to highly observe the following. 1. Wash hands frequently with clean water and soap. 2. Avoid contact with infected individuals, particularly touching the eyes and shaking hands. 3. Refrain from sharing personal items. And 4. Those infected are advised to visit the nearest health facility for supportive treatment. The public is advised not to panic but remain calm and observe all the preventive measures listed above. The more at-risk population at schools, universities, prisons, internal displaced camps, which is IDP, refugee camps, are urged to be vigilant and report all cases to the National Outbreak Hotline, 6666, or the nearest healthcare facility. Thank you so much for coming. The end of the press.
Question. We are getting that also there are schools that are closing. We would like to hear from you. Are there schools that are closing, or do you recommend schools to close?
I can confirm that because now I'm dealing with my mandate, which is the health aspect of it, which is like, what the press statement that I've just given. But the closing of the schools and the measures to do that, I will leave it to my counterpart, the general education. And what we can do is give them advice. Yeah.
Are there vaccination or any precaution that will be given in schools?
It is more of the precaution that we have already highlighted here, because, like as I mentioned, like the causes of the red eye disease can be bacterial, it can also be viral. So, but the best thing is to try and prevent it, and then seek treatment like at the nearest healthcare facility. So, supportive treatment.
Can it lead to death in case if it's not well treated?
Sorry?
Can it lead to somebody to die?
No. No, not really. I don't think that we have really confirmed it yet. But the main thing is very painful. It's very discomforting. It is very, very, like, you really have to try and prevent it than getting infected.
How are we going to work to make sure that the cases don't increase, since there is traveling happening every time, especially from Nimule? As you said, there are cases that have been registered, suspected. How will we reduce these kind of cases from spreading?
Now, what we are doing as the Ministry of Health, we are following World Health Organization guidelines. These are the guidelines that are set standardly, for all the countries in the world, and that what has been done in Uganda, that what has been done in Tanzania, that what has been done in Kenya. So what we are trying to do is to make sure that we strengthen our port of entry screening, measures, and then when we find that somebody is treated, what we do is making sure they are actually contained and isolated and treated. We treat you we actually treat your eyes with virus eyedrops. Sometimes there's need, we use antibiotics and all this kind of thing. So the most important thing is to contain it by screening, making sure that if we suspect somebody is having like this disease, red eye disease, we contain them, we treat them before they can mingle with the rest. But it is just like a normal, like an outbreak that we have, and you have just to follow the measures.
Okay, in case someone gets the eye problem and it's not well managed or not treated, is there any worry of losing the vision?
For time being, we want to prevent from speculating that. But the most important thing is once you detect that you have got like the disease, go to the nearest healthcare center so that it can be confirmed. And by the way, we have got so many eye diseases. We have got seasonal allergies. We have got people who are allergic to perfume. We have got people who are allergic to so many things. So the best thing to rule it out is to go to a healthcare facility. And we have some tests that we do. We run some tests to know what we are suffering from. It is this either red eye disease or let's say cataract, or let's say it is something else that we are running with. Yeah.
When someone is isolated, how long will the person take in the isolation?
It depends, because like the highly active phase is between 10 to 12 days. That when you are highly contagious, and that is when like you are experiencing all these painful symptoms. But the infection can be in your system up to 3 weeks. So sometimes we just kind of treat it case by case. Some people, they can get infected today. Maybe after 1 week, they are completely cleared up and they are fine. I have people in my house. We detected it like maybe on Thursday. Now today they are feeling better. And it is Monday. So it's sort of like a case by case. But you need to know it is from 0 day to 3 weeks.
Okay. Well, I have a concern. There's a school that where this outbreak of eye problem started. Last week I talked to the head teacher, and they said about 100 of the students got the infection, and they sent 50 of them home because some of them had already recovered. Then in such kind of setting, it is a boarding school. In such kind of setting, what would you advise?
The main thing, as we have mentioned here, do not share personal items. And also, we have to observe, like, touching our face. Sometimes, like, we want to touch our nose and we want to touch our eye. You have to make sure that you observe, like, hygiene. Clean with clean soapy water. Pretty much that is it. Clean your clothes. And sometimes in school, children, they would like to share clothes. They would like to share T-shirts, and you will clean your face, and then your friend will also come and take it and clean it, and maybe it is not cleaned properly. We are trying to advise everybody, observe for this period of time, personal hygiene, no sharing of personal items. And at the same time, if somebody is suspected to have got a red eye disease, instead of going out to the public, try to actually stay at home. like children who like in my house, the case that I mentioned, I suspected that child on Wednesday. So on Thursday, I told them, no, you should not go to school. Say, no, it's because I touched my face with something. I say, no, you should not go to school because we have got an outbreak that we are trying to monitor. So it is to kind of keep away from the rest, of the crowded area. Because let's say if in a school setting, they are sharing the same water tap, they are touching the same knob, and they are touching their face. And also hygiene is very important. Clean also the surfaces. Even here in my office, we like to wipe down the tables after we have a meeting. So it is mainly cleanliness.
Yes, how many cases have you registered so far in Juba?
Juba right now, my team is working on it, and it's going to be quite a bit of cases compared to what we have in Nimule. Yeah, it is going to be now you have already heard from her, and we have got so many unconfirmed cases. And it is actually almost in the whole country, because I'm also hearing some cases all the way in Rang, and I'm hearing some cases all the way in Mundri. So it is almost throughout the country we have got it's infection that is going on, and our team are working day and night to collect the sample and try to confirm. But rest be assured, we have already confirmed it in Nimule. Yeah.
And then who are the most vulnerable people to this disease? Is it men, women, children? Who exactly?
It is anybody who lives in a crowded setting. It's anybody who lives in a crowded setting. Of course, some are going to be more vulnerable, especially children of school age, and those who are in prisons, because they share a lot of things together, and it kind of impact anybody. This type of disease is not picky. As long as you have got an eye, it is going to impact it. And also pets, by the way. It's also impacting dogs and cats and all this kind of thing, because they play with you and you touch them.
Thank you.
I have one question.
Mm-hmm.
This one is out of the topic. There's this reports coming from Western Equatoria, basically Yambio and Nzara, that there's an outbreak of measles, and then there are reports that some children have died. So is the national government aware of these cases? And is there any response or intervention?
To be honest, and I will leave the acting undersecretary to comment shortly, to be honest with you, we have got pockets of the outbreak of measles throughout the country. And why is that? Because we had got a break during COVID-19 pandemic, whereby the vaccination, the children were not frequently vaccinated properly. So that cohort that was not vaccinated at that time are now the ones that are getting infected more. That's number one. Number two, the crisis in Sudan, whereby the people came back to South Sudan and they are going to their communities. It is also another problem, because most of those children coming in are not also vaccinated. So when they come and they mingle with everybody else in South Sudan, it is also another issue. So we have got pockets of outbreak of confirmed measles and some other diseases, including meningitis.
Yeah, I think the Honorable Minister has